Caregivers can place their family members at risk in two ways, and both situations are preventable. First, despite their good intentions and hard work, they may unintentionally harm their loved one. The risk for injury is directly related to the lack of knowledge and competence, which can be improved through the caregiver education and support. A recent study confirmed that patients had many negative outcomes when untrained, informal caregivers managed their home enteral nutrition tube feeding. Problems included tube displacement, tube clogging, infection, and dehydration, all of which can lead to stressful caregiving situations and hospital readmission. Depressed caregivers are more likely to harm their spouses. Caregivers who are at risk of depression while caring for spouses with significant cognitive or physical impairments are more likely to engage in neglect or abusive behaviors. Researchers have found that counseling and support for caregivers who face disruptive behaviors from their family members will decrease stress. Caregiver knowledge and skill is an important example of the potential to harm the patient during the administration of medications. Research has identified that caregivers manage between 1 and 14 medications on a daily basis. Their responsibility to monitor for adverse or toxic effect in family members who are unable to report problems themselves is important in preventing dehydration brought on by vomiting, diarrhea, or more serious complications. Caregivers need education to both recognize adverse drug effects and help in developing the critical thinking skills that will help them manage these potential problems. The caregiver's perception of the care situation is the most crucial in understanding the potential for harm. The amount of bother the caregiver perceives in relation to the patient's symptoms affects their ability to accurately assess the patient's symptoms, particularly pain and the patient's ability to care for themselves. Neglect is more common when the caregiver is fatigued or distressed, and when caregivers have a high level of burden, care becomes inadequate. Research in the area of caregiver burden suggests that home health nurses should develop interventions early after hospital discharge and continue to assess and improve family caregivers' health perception, mental health, and social support.